I'm Dan Hoost. I'm the county's communications director, and I'm here with Sullivan County Public Health Director Nancy McGraw for another very timely update on where we are with coronavirus in Sullivan County. Unfortunately, the news isn't the greatest right now, and Nancy and all of us really who work at the county want you to be aware of some certain key aspects of what's going on and what you can do to help mitigate the spread. Nancy, thanks again for joining us today. What's the latest with coronavirus in Sullivan County? It looks like the numbers are rising.
Good afternoon. Yes, the numbers are rising, unfortunately. We're always vigilant. We had a reprieve for several weeks, and we were hoping that, the cases would continue to be very low, given what's going on around the country with the Delta variants and still struggling to get those vaccination rates up. We were concerned that this might be coming our way.
What?
Yeah. As of Friday, we had 53 active cases and 83 in isolation and quarantine. That was up from the previous, week or so. We stayed pretty low, right around, less than 10, and then it creeped up to 20. So we are seeing a steady increase over the last few weeks. Over the weekend, we took a big jump of about 20 cases, and we have seen 4 additional admissions to the local hospital here, and 1 is in the ICU. 2 of those hospital admissions are among people who are fully vaccinated, so they may be breakthrough cases. We're very concerned about this, and although it is a very low number, it does show that the Delta variant is spreading very quickly, and it's widespread, and we should be concerned about it.
You talk about breakthrough cases, meaning that these are people who the virus broke through the vaccination, if you will. Is this something in line with the statistics or something we should be worried about for those of us who have already been vaccinated?
Well, it's something that the researchers and the medical community is watching very closely, the CDC and the State Health Department. Vaccination provides very good protection. We want people to really understand that no vaccine is 100% effective, but it is very, very effective in preventing serious illness, hospitalization, or death. There will be inevitably a few breakthrough cases, and those numbers are very low, but because it is happening and it tends to be in conjunction with our concern about the Delta variant, it's being watched very closely. So the other piece of this is that with new evidence, sometimes recommendations do get changed and updated, and this is based on new science. Remember, this is still a newly evolving virus, which is mutating. Then we follow the lead of the CDC and the State Health Department. We want to make sure that people understand that, yes, there are cases out there where people who are fully vaccinated can test positive. We see that as a breakthrough case, and then they are likely, or not likely, but able to transmit that virus to others. And if they transmit the virus to someone who's not vaccinated or whose health is not good, or they have underlying conditions, it poses a higher risk to them, as well as children who are too young to get vaccinated yet.
So you're still recommending that people get vaccinated.
Yes, absolutely.
And how can they do so?
There's 2 very easy ways to find out a location of where you can get vaccinated. One is our clinics here every week on Wednesdays at Public Health, 50 Community Lane, from 2 to 6 p.m. You can register ahead of time through our website, or you can just walk in.
And what kind of vaccine is that?
Currently, we have Pfizer.
So that's for 12 and up.
That's for 12 and up, and you would need to come back for the second shot in 3 weeks. There is a limit on Janssen, J&J right now because of its availability statewide. We do have a little bit of that, but we're really giving out Pfizer in our clinics right now. The other way to find a vaccine close to you is to text your zip code wherever you're staying, either permanent residents or you're temporarily here for the summer, text your zip code to 438-829, and you will get back a text message within a matter of a minute that shows you a list of all the pharmacies, providers, and health departments in your area that currently have vaccines. So this is kept up to date, and it will provide you with that information. Or you can call 1-800-232-0233 for the same information, or go on vaccines.gov.
And for those of us who are vaccinated, what now?
It's really important that we understand that although we got vaccinated so we wouldn't have to wear a mask and we would be protected, that the science evolves and the research is an ongoing process in terms of how this virus is being transmitted, who it's affecting, what's happening with the variants. So what we currently know as of today is that even though you're vaccinated, you can still test positive, and you can also transmit the virus, the Delta variant especially, to others, and to others who may not be vaccinated, may be high risk, immunocompromised, or may be too young to get the vaccine. So at this point, when you're indoors and you cannot maintain a social distance of 6 feet, even if you're vaccinated, we're making it a strong recommendation that you wear a mask, and it's the right thing to do to protect other people at this point until we get a lot more people vaccinated.
The CDC has put us in a special designation now, right? A substantial?
Yes.
What does that mean?
We're in what they call a substantial transmission zone for the virus, and that's based on population size and number of positive tests, number of positive tests for the variants. We need to assume that transmission is widespread because of the CDC surveillance, which is much more robust at this point. They extrapolate based on population and a variety of other factors in terms of who's reporting to them, who may not be necessarily reporting directly to the state for surveillance. So we can assume that the Delta variant is widespread, and we should be taking preventive actions.
If it's not here, it's going to get here.
Correct.
Is there any other information you think people should know at this moment?
I think if you have been waiting, or you know someone who has been waiting and uncertain about getting the vaccine, this would be a really important time to call us, to call your provider, to look for more information and get your questions and concerns answered, to sign up for a vaccine, to come in and talk to our nurses. You can change your mind once you get here if you don't want to get vaccinated. But it's important to have somebody to talk to who has the information that's scientifically based and that can answer your concerns. This is going to unfortunately continue until we get enough people vaccinated, much more than that 70%, and we're about 10 or 15% off of that mark right now, and the variants are taking hold, so that's not good news. We were hoping that we would get everybody, as many people vaccinated. We're not the only county in the state. There are many counties that reach that 60%, 65%. Some reach 70 or higher. Our senior population is about 77% vaccinated, so that's good news. But there's a lot of other people that chose not to get vaccinated, so now is the time to do that.
All right. Thank you, Nancy. I'm sure we'll be checking in with you a little more frequently now as things progress. So appreciate your time.
Thank you.